This is All India Radio Mangalore. Dear listeners, today, October 10, is observed as World Mental Health Day. In connection with the occasion, Dr. Shishir Kumar, Psychiatrist, Justice KS Hegde Medical Academy, Mangalore, now speaks on the topic, Make Mental Health and Well-Being for All a Global Priority.
World Mental Health Day was observed for the first time on 10th October 1992. Since then, it is observed every year on the 10th of October with the aim of raising awareness in the general public and global community about the critical mental health agendas. Since 1994, the World Mental Health Day is observed with focus on a specific theme each year. The theme for 2022 is Make Mental Health and Well-Being for All a Global Priority. Let us first understand what is mental health and well-being. The World Health Organization Constitution states, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Mental health is the balanced development of the individual's personality and emotional attitudes, which enable him to live harmoniously with his fellow humans. The World Health Organization defines mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. What that means in simple terms is that a mentally healthy person has three characteristics. He is comfortable about himself, he is in harmony with people around him and his environment, and three, he is able to meet the demands of everyday life and lead a productive life. There is no scientific reason for us to differentiate between mental health and other kinds of health. Since the mind and the body are closely related, and the mind being a function of the brain, we can say that mental illnesses are the same as physical illnesses. Why should we talk about mental health and observe Mental Health Day? The reasons for this are several. There is an increase in mental health conditions worldwide. Between 2007 and 2017, there has been a 13% increase in mental health conditions and substance use disorders. Mental health conditions now cause 1 in 5 years lived with disability. Around 20% of the world's children and adolescents have a mental health condition. Suicide has become the second leading cause of death among 15 to 29-year-olds worldwide, and the leading cause of death in that age group in India. It is said that every 40 seconds a person dies by suicide. That means, by the time you have finished listening to this talk, about 20 people in the world would have died by suicide. That is a huge number. In India, there were 1.64 lakh suicide deaths in 2021, which was a 7.2% increase over the previous years. We know that the suicide rates has been steadily increasing in the recent years in India, and India has been reporting the highest number of suicides in the world. Mental disorders are a significant contributor to suicide deaths, and many suicides are actually preventable. Therefore, recognizing and treating mental disorders and mental distress can actually save lives. This one fact is reason enough for us to talk about mental health. The incidence and severity of mental disorders is increasing in India too. According to the Global Burden of Diseases study published in the Lancet Journal in 2020, 19.73 crores of people in India suffer from mental disorders, which include 4.57 crores with depressive disorders and nearly 4.5 crores with anxiety disorders. That is, nearly 15% of our population suffer from mental disorders, which is significantly more than the World Health Organization estimation of 10% for global population. The contribution of mental disorders to the total disease burden in India has almost doubled since 1990. The National Mental Health Survey 2015-16 also highlights similar burden of mental disorders. Tobacco and alcohol use disorders are also major contributors to disease burden. We have political conflicts, military conflicts, civil unrest, and warlike situations in many places in the world today like Ukraine, Burma, etc. Such unrest and civil disturbance can also lead to an increase in mental health problems. Approximately 1 in 5 people, that is 20% of people in post-conflict settings, have a mental health condition. During the COVID-19 pandemic, we have seen an increase in anxiety and depressive symptoms. Along with the fear of contracting the virus, there were significant changes people had to make in their daily lives, as our movements were restricted during the lockdown in an effort to contain and slow down the spread of virus. People were faced with new realities of working from home, unemployment, financial loss, homeschooling of children, and lack of physical contact with other family members, friends, colleagues, etc. All these have contributed to an increase in mental health problems. Mental health conditions affect all areas of our lives, such as school or work performance, relationships with family and friends, and the ability to participate in community activities. Anyone can be affected by mental illness. Any person of any age, gender, religion, caste, region, socioeconomic status, profession can develop mental illness. We are all equally vulnerable. Therefore, mental health is everyone's business, and every person should make it their business. Mental health issues affect 1 in 4 persons in their lifetime. We cannot afford to think that mental illness is something that affects others and not us. The 2 most common mental health conditions, namely depression and anxiety, cost the global economy $1 trillion every year. So worldwide, depression, anxiety, and other mental disorders are major concerns. Despite these figures, less than 2% of the government health expenditure goes towards mental health globally. There is an important matter of the treatment gap. Not everyone with mental disorders receive the treatment they require. This gap between the number of people who are in need of treatment and those who do not receive treatment is called the treatment gap. 35 to 50% of people with serious mental illness in developed countries and 76 to 85% in the less developed countries received no treatment in the previous 12 months. In India, the National Mental Health Survey reported an overall treatment gap of 83% for any mental health problem. That means 83% of people with mental health problems did not receive treatment. The treatment gap reported for common mental disorders, namely major depressive disorder and anxiety disorder, was 85%, which is higher when compared to those for severe mental disorders like psychosis and bipolar disorder. The treatment gap with substance use disorders is even higher at 90%. Persons with mental illnesses are likely to experience disabilities resulting from the impairment of mental or emotional functions. Mental illness significantly interferes with performance of major life activities such as learning, working, and communicating with each other. More than 50% of subjects reported disability in family life. More than 60% of the affected reported disability in work and social life. Depressive disorders are the biggest contributor to disability, followed by anxiety disorder, intellectual disability, schizophrenia, bipolar disorder, conduct disorder, autism spectrum disorders, eating disorders, and attention deficit hyperactivity disorder. 5 of the 10 leading causes of health-related disability are mental health problems. The socio-economic impact of mental health morbidity is also quite high. Individuals with mental disorder are often not able to maintain meaningful employment or do only some activities due to their mental illness. The economic impact was higher for bipolar affective disorder, psychosis, and schizophrenia. In that, during the time of illness, they are unable to work more than 50% of the time. People with mental illnesses need support and supervision from family. According to the National Mental Health Survey, family members had to forego an average of 10 working days with potential loss of earnings in the previous 3 months to take care of those with chronic conditions. In addition to this, there is the cost of visits to the doctor, cost of treatment, etc., which add to the total financial costs. This is particularly worrying for people in poverty and with low income. There are certain challenges to delivering effective mental health services in India. First, and important among them, is the lack of awareness among people and public. Mental health literacy and awareness is low in our population. Mental health literacy includes knowledge about symptoms, recognition of illnesses, their causes, self-help, and facilitation of professional treatment, that is, knowing who to refer and how to refer for treatment. Awareness programs have shown to improve knowledge and literacy about mental health. Stigma and discrimination is another huge problem. These are consequences of ignorance and misinformation. Stigma about mental disorders is high even in Western societies, but is a bigger problem in India. Stigma is not restricted to lower socioeconomic societies. Even highly educated parents find it difficult to accept that their children could be experiencing mental distress. Fear of being discriminated by society and perceived stigma can be a hurdle for timely help seeking. Certain cultural beliefs can be a hurdle for effective mental health care. Quite often, people attribute symptoms of mental disorder or distress to supernatural experiences, astrology, horoscopes, evil eye, possession by spirits, displeasure of gods or demigods, etc. Due to these sociocultural beliefs being highly prevalent in our communities, people tend to visit their local faith healers. This leads to delayed recognition of mental disorder and also delays initiation of appropriate treatment. Limited access to doctors, psychiatrists, and mental health professionals, particularly in rural areas, make it difficult for people to receive timely help. Non-availability or the limited availability of medications and specialized treatments, particularly in primary health centers, is also a huge hurdle. Where appropriate treatment is not freely available through primary health centers, people have to rely on treatment from private practitioners, which can be very expensive for many people. Often they would have already spent a lot of money on magico-religious interventions through their faith healers. High treatment costs could discourage people from continuing treatment in the long term. Poor compliance with prescribed medications and treatments is another problem. Even with chronic medical conditions like diabetes and hypertension, people often forget to take their tablets, and adherence to medications over a long period is difficult to maintain. With mental health problems, people often lack insight and awareness into their mental health condition, and therefore do not see the need to take medications. This leads to poor compliance and frequent relapse of their mental illness, which leads to increased number of hospital admissions and increased costs. So what can people do to improve their mental health and well-being? Well, one thing we all can do is to educate ourselves on the common mental health disorders so that each one of us can recognize signs of mental ill health or disorder in both ourselves and people around us to seek appropriate treatment in a timely manner. We need to be sensitive and comfortable about other people's mental health issues. We need to be inclusive, and please do not discriminate against people with mental health problems. Do not hesitate to talk about your mental health. It may help you feel better and also encourage others to discuss their problems with you. Please do not be dismissive about people's problems. Comments like, "Your depression will go away," or "You just need to cheer up," or "If you keep yourself busy, you will be fine," are not helpful. If you come across people who talk about giving up on life or thinking about committing suicide, please do not dismiss such comments. Instead, give them some of your time and try and listen to their problems. Ask them to seek help from a mental health professional. Just being there for them, being willing to listen to them, could give them hope, and you may actually save a life. If either yourself or anyone you know has been diagnosed with a mental illness, it is important that they attend regular follow-up appointments with their psychiatrist or counselor and adhere to their treatment plan. If they are having any problems or side effects from their tablets, they should discuss this with their doctor and should not stop their tablets abruptly. Please be sensitive to people from vulnerable communities like the elderly, children, pregnant women, women who have recently given birth, people from LGBTQ community, as they have additional mental health needs. It's important to think about what we can do to prevent mental ill health and promote our mental well-being. The important change that we can make is lifestyle modifications. We should avoid alcohol or any other substance use. If any of you are already using alcohol or tobacco products, please try and stop. If it is difficult to give up alcohol or tobacco, you could get professional help. Eat healthy, well-balanced meals and maintain regular meal times. Have a healthy sleep routine and maintain good sleep hygiene. Ensure adequate rest. Keep physically active with moderate exercises. Engage in meaningful vocational, employment and leisure activities. Take up employment that will be enjoyable, meaningful, and gives you a sense of purpose. Leisure activities can be anything that brings you joy, like singing, painting, dancing, gardening, playing music, or even taking up a new hobby. We all need some personal time for ourselves. Practice compassion. Generosity and acts of kindness help in making us feel good about ourselves and improves our mental well-being. Spiritual practices like meditation help in reducing anxiety and improves our physical as well as mental well-being. So in conclusion, I would like to say one take-home message. Mental health problems are increasing and we need to take action now in order to maintain our well-being. The theme for Mental Health Day, which is Make Mental Health and Well-being for All a Global Priority. Now, each one of us should make our mental well-being our priority and also the mental well-being of our loved ones. I wish you all good health.
Dear listeners, you have just heard Dr. Shishir Kumar, psychiatrist, speaking on the subject, Make Mental Health and Well-being for All a Global Priority. This talk came to you from the studios of All India Radio Mangalore.